I am Professor Pierre-Emmanuel Rotou, and I am very pleased to present you the Decision Project, a project funded by European Union. The Decision Project is coordinated by the European Foundation for the Study of Chronic Liver Failure. The Decision Project is based on three very large cohorts, Canonic, Predict, and Aclara, that have been created by EF Cliff, and these cohorts gather together more than 2,000 patients with biosamples available, and these patients have been included in Europe, but also in South America. The Decision Project has four aims. First, to provide a better understanding of the pathophysiology of acute decompensation of cirrhosis. You can see here the pathophysiological concept we will develop in the Decision Project. Acute decompensation of cirrhosis is usually triggered by events like infection, bleeding, or binge drinking. But why some patients develop ACLF or death while others recover is unknown, and we want to understand this outcome by taking it into account various features including individual susceptibility, systemic inflammation, hypometabolism, multiple organ involvement, biological age, and also the concept of liver functional reserve. And we hope that thanks to Decision, we will have a better understanding of the pathophysiological pathways underlying the outcome of patients with decompensation of cirrhosis. The second aim of Decision is to refine existing animal models of acute decompensation of cirrhosis leading to organ failure and to develop new models. In blue here, you can see the available models, and in orange, the models that we will develop to try to mimic the human disease by developing models of NASH, of alcohol consumption, and by having triggering factors close to the human situation, including infection, including also alcohol binge. And we will provide a comprehensive assessment of each organ failure in these models. The last aims of Decision is to identify new combination of existing drugs to give to patients with acute decompensation of cirrhosis and to provide novel tests. Here you can see in blue the current management of patients with acute decompensation of cirrhosis based mainly on the treatment of triggering factors with an associated poor outcome, since there is a mortality at day 90 of 14%. Following Decision, we will develop a new strategy where first patient will undergo a test allowing to determine the outcome of the patient, and if the outcome is good based on current treatment, this patient will receive standard medical treatment and will be rapidly discharged. On the contrary, if the outcome is predicted as poor, then a second test will be performed, a test for response to the combinatorial therapy we will develop. And if the patient is a responder, he will receive this treatment, and if not, he will be considered for more aggressive therapies. The Decision Project is a 5.5-year long project. This project received from European Union 6 million euro, and this project includes 21 institutions in 10 countries. I would like to thank you for your attention.